Hello, I'm Dr. Vidya Pawar. I'm an eye surgeon. I'm working with our Aditya LASIK Center camp and Aditya Eye Hospital Yeroda for last 26 years. We have this epidemic of conjunctivitis going on in Pune, or rather whole of Maharashtra these days. Through the platform of Karyasiddhi Pratisthan, I have got this opportunity to spread public awareness regarding this conjunctivitis epidemic. This eye infection is usually referred as conjunctivitis or pink eyes or sore eyes. This is because of viruses, happens because of viruses, and because of this damp weather or because of this rainy season, these viruses multiply and spread faster. So we have this epidemic outbreak. Symptoms of this infections are usually red eyes, watery eyes, there can be lid edema, there can be intolerance to very strong light, and at times you can feel feverish also. Okay, these symptoms usually come in couple of days after you've come in contact with a person who has got conjunctivitis. This viral infection is very contagious. It spreads very fast, and basically it's not airborne, it is touch-borne. So if a person who's got conjunctivitis touches his eyes and then touches the routine things like mobile or remote or light switches, and the other person comes in contact with the same surfaces and rubs his eyes, the other person becomes a patient. So basically it turns into an epidemic through public places. That is why this infection spreads very fast in public places like buses or offices, school, colleges, hotels and gyms. Okay, so if you develop any of the symptoms which I just described, you should seek medical help as early as possible. You should meet an eye surgeon so we can treat your symptoms accordingly. But using steroid drops without medical prescription and without doctor's guidance can be harmful. So that is one word of caution about the treatment. To control the spread of the infection, prevention plays a very big part to control this epidemic. So to begin with, the person who's got infected should really isolate himself. He should avoid public places. He should not touch his eyes very often, and if he does or if it waters, then he should be using tissues to clean the eyes instead of handkerchief. Then hands should be washed very frequently. You should be using sanitizer generously. If the children are affected, don't send them to school for 3 to 4 days. Okay, if you wear contact lenses, stop the contact lenses for 4 to 5 days. Don't share your personal makeup or personal things with the people who are infected. There is a myth regarding this infection that you can get infected if you look into the eyes of a person who's got conjunctivitis, but that's a misunderstanding. That's just not true, because this infection is not airborne, it is touch-borne. So if you come in contact with somebody who's infected, you should surely wash your hands very meticulously and avoid touching your own eyes. So just to conclude, if we all practice good hygiene and take good precautions, we all will be able to stop the further spreading of this infection and further outbreaks. My best wishes for the noble work done by Mr. Giriraj Sawant through Karyasiddhi Pratisthan. Thank you.